Sawasdee Krap, and good afternoon once again. Friday, the 30th of April 2021, the last day of the month of April now. So thank you to Dr. Tawisin just now for the summary that he gave us. He ended with some important keywords. First of all is that the CCSA here, as I mentioned quite often, we provide you with the most factual and evidence-based information for the benefit of the audience. Now, one challenge that we've always been facing is striking a balance, be it the measures that we come out with, or the relaxation of measures, or making the measures stricter, adjusting. All of these things from time to time, the balance has to be struck. Now, Dr. Tawisin ended with some words. For example, these few days we've been talking about the various stricter measures which will be in effect starting tomorrow, the 1st of May. Now, those who understand these policies, they say it's very, very good. It's about time that we have stricter measures according to the situation, the current situation we have now. Now, another side of the people would say they're dying already from the lockdown or from the various measures. They can't do business. There's not any thing to do anymore in terms of business, in terms of the normal activities. So this is a challenge that we've always been facing, and rest assured that we take all of the hardships of all groups, all sectors in society into consideration in striking this balance, in coming up with the various measures. So this balance is very important. We understand that businesses are affected, while we understand that there has to be some sort of stricter measure in this time, especially during this time. So please bear with us. We bear with you, you bear with us. We are, of course, in the same boat, in the same challenge, and hoping that the 14 days ahead, looking forward to the 14 days ahead as a test, as the test of the country, of Thailand, on how we will be implementing and enforcing the stricter measures in the 14 days, and what the results will turn out to be after the end of 14 days, after the 1st of May 2021, when we have the stricter measures. So, in terms of the doses of vaccines, right now we have up to 1.4 million already. 1.4 million doses of vaccines inoculated in Thailand already. And although it's not a very high number yet in comparison to comparatively to our population, but the number will be growing exponentially in the coming days and weeks and months ahead. So I'll start with the numbers we have for today. New confirmed case, 1,583 cases. Quite a good number in the past 1 or 2 days compared to the past week, where we had 2,000 plus in the mid-2000s daily. Now we have 1,005 recorded for today, wherein of that number, 1,366 are from local transmission, and 213 from active case finding, and 4 from within the state quarantine system. The active cases that we have is 28,696. Of these active cases still being treated, 871 cases are in critical condition. Out of the 871 cases in critical condition, we have 250 cases on ventilators. Also recorded for today is 860 new recoveries. Now that's compared to the 1,583 new confirmed cases. So actually at a deficit there. In terms of fatalities, today we recorded 15 new fatalities. Unfortunately, these past few days we have had over 10 fatalities for a couple of days now, making the cumulative total of fatalities at 203, as you see on screen. Of these 15 new fatalities, 9 male, 6 female, age range from 29 to 93, and the median age being 75. In terms of the distribution, in terms of provinces, of these 15 new fatalities, 9 fatalities are in Bangkok, and one fatality each in the province of Chonburi, Pathalung, Surat Thani, Nakhon Pathom, Ratburi, and Prachuap Khiri Khan. And you see on screen there, sort of like a map of the distribution of cases that we have in Bangkok in the various districts in Bangkok. Now you see in the eastern part of the city, that's in yellow. So that's the area where we don't have as much of infections, but the rest of the districts in Bangkok are mostly all red or dark red. So we have to be very, very aware of the situation now. Just be very, very careful and follow the measures that we have announced. So this is just a visual for you to see where we are right now. Now, most of the new fatalities suffered from high blood pressure, diabetes, heart disease, and high cholesterol. The provinces with the highest number of confirmed cases, of course, is Bangkok. We had the map just now, and you have the chart right here. Bangkok with 417 cases, followed by Samut Prakan, 138, Chonburi, 131, Chiang Mai, 66, and Nonthaburi at 50. And while the number of new confirmed cases is lower than the past few days, we must remain vigilant as we still have new clusters of infections still found in Bangkok and in various other provinces, such as in Bangkok, in Klong Tei district. In Ranong province also, there are 36 new cases which have been found to be related to a snooker club and an illegal gambling den. Therefore, it is important to avoid large gatherings and practice social distancing measures. And while the number of new confirmed cases in Bangkok today is lower than 500, it's 417, the number of new fatalities in Bangkok remain high, as I mentioned. And to prevent further loss of life, the public is urged to follow the measures very, very strictly. So yesterday, we gave you a recap of the general CCSA meeting. I'll just go through that today again very, very briefly. So chaired by the Prime Minister, of course, rezoning of the provinces into different zonings, the maximum and strict control areas, which include Bangkok, the maximum controlled area and the controlled area with the corresponding measures as you can see on screen. Now, of course, in all provinces, the consumption of alcoholic beverages in restaurants is, of course, banned, as well as the closure of pubs, bars, and karaoke businesses. The 1st of May would also see restaurants in Bangkok have no more dine-in. Dining in restaurants in Bangkok will be prohibited from the 1st of May onwards. As you see on screen, it's highlighted in red, actually, but takeaway is allowed. And of course, mask wearing is mandatory in all public areas nationwide. Mask wearing, this is now for the whole country now. If you go outside in public and don't wear a mask, if you violate that, you'll face a fine of up to 20,000 baht. And all measures, as I mentioned, will be effective from the 1st of May tomorrow. So we seek your cooperation also from the public and private agencies to reduce the number of people going to work and allowing work from home for at least 14 more days until the middle of May. That's the most ideal, and it's what we recommend. It's what all government agencies will be doing, and hoping that the private sector companies will follow suit. These measures have been carefully reviewed by all agencies to ensure that they can effectively curb the spread and having minimal impact on the livelihood of the people. And as I mentioned in the beginning, balance is the key word that we have always taken to heart. For example, the closure of businesses such as malls and convenience stores will have an immense impact on the employment and on the supply chain. So these businesses, however, must limit the number of people on the premises and enforce social distancing practices. The CCSA has also approved the extension of the quarantine period for international travelers, regardless of their nationality or vaccination status, and all arrivals who hold the certificates of entry starting from the 1st of May, will be required to undergo quarantine period of 14 days. And some details, of course, on screen for you right now. These measures aim to ensure that there will be no local transmission of the new variants of the virus in Thailand, as the healthcare system is already facing a high number of patients being treated, and this measure will be reviewed in due course as soon as the situation improves. One note on the patient admission center in Hoa Mak Stadium in Bangkok, now open, of course. Those who have been diagnosed with COVID and are waiting for hospital admission can visit the center to receive health checkups and be assigned with hospital beds accordingly. And you have some images there on screen. The center aims to reduce the waiting time for the patients to prevent them from developing severe conditions. And patients can contact the number 02 079 1000. So once again, 02 079 1000 for transportation arrangement for this facility. Yes, so just like to inform you about buying goods from department stores and supermarkets. Of course, there are now shorter times where department stores are open, of course, retailers and convenience stores as well. So the Department of International Trade has asked all shopping malls and retail stores to stock up on necessary goods to meet with consumer demand. Because the current wave right now, it's still volatile. And the department wants to make sure that there are enough necessary goods, staple products, goods like rice, dry and frozen food, canned food, and drinking water for sale at supermarkets, as the public may increase their purchase during the ongoing outbreak and, of course, while working from home as well. And they also ask the operators of online food delivery platforms, which are expected to receive more purchase orders when you order food to be sent to your condominium, for example, by motorcycle, for them not to increase the service prices. So just to recommend you not to go for any panic buying spree at stores, as we are guaranteed that there will be enough goods, essential goods, staple goods available in the various retail establishments and supermarkets during this time. So during this weekend, we'll see you again this weekend, of course, during Saturday and Sunday, as soon as we have any important information that are specifically relevant to the foreign community, the foreign nationals in Thailand. We'll come up with that as soon as possible. One issue would be talked about tomorrow as well. So hoping to see you again tomorrow. Thank you very much for your attention. สวัสดีครับ
กราบขอบพระคุณค่ะท่าน